Record gas prices combined with inflation are a 1-2 punch for many patients with chronic conditions. That worries some healthcare providers, concerned that patients may opt to delay their medical care to save money. Just ahead, what you can do now to hold down costs and get the help you need. Welcome to the Morning Medical Update. And good Monday morning to all of you. It is June 27th. I'm Jessica Lovell. Thank you so much for being with us here on Facebook, YouTube, and on Twitter. Coming up, ever wanted to know more about the person you see behind the mask? Well, we salute our first doctor in this new series that we love, and we hope you will love it too. Dr. Dana Hawkinson joins us with the latest COVID-19 count. But first, inflation now causing some people to choose between food, gas, and medical care. We know you will have lots to share on this topic, so please start sending in those questions now. You can do that on YouTube, Facebook, Twitter, and the Medical News Network. You can find links to those right there on your screen. The latest data from the Bureau of Labor Statistics finds airfare is up about 40%. Groceries up about 12% compared to this time last year. And of course, gas prices also giving us major sticker shock. It is taking a toll, especially for patients with chronic illnesses who need to get to their regular treatment. Patients like cancer patients. And there is a bridge to better managing some healthcare expenses, though. Our experts today with us are Jason Grunstrom, Executive Director of Continuum of Care, and also Gail Saunders, Social Worker Manager, both here at the health system. Good morning to both of you. Thanks for being with us.
Thank you. Good morning.
It's such an important topic, and I think it hits all of us in some way or another, or certainly maybe someone we know. So I'm really interested to hear what you have to say today. So Jason, I have heard you say before, engaged patients, they really can help in better managing their own medical expenses. What do you mean when you say engaged?
Yeah, absolutely. Thank you for the question. You know, engagement can come in many different forms. Engagement in your health. You know, we all have trackers on us, and we're all trying to do, eat better, sleep better, engagement that way. But also engagement financially is also a different thing. I don't know if we talk too much about in just healthcare in general. You know, hospitals have financial counselors, and that's not unique. That's not different than here at our health system. And so engagement from a financial perspective, I really want to encourage a lot of our patients who come in to not just kind of think, oh, my insurance company is just going to take care of it. And then we wait until that bill comes at home, and then the second bill and the third bill. We're experiencing this in my personal family. I have my insurance. My wife has her own insurance from her employer. And we always find that they're a little bit different. And so I want to encourage everyone, we know our car insurance. We know our car insurance pretty well. We know our deductible and what it covers. Sometimes we don't know that too much about our personal health insurance. And so an engaged patient, when we talk about that, engagement before you even start coming to the health system, to look at what your insurance covers and know your deductibles and know all the little different nuances, because it's very important. We have financial counselors, and so when things do get confusing, you can work with your social worker or case manager to find out and get directions on how to get to a financial counselor. Our hospital has them, many hospitals have them, and so that's what I mean when I want to encourage people to be engaged, not only just in their health, but also their financial health, and health systems do have those opportunities.
Well, you mentioned car insurance, something of course we think of because we're behind the wheel every single day, and you don't think of health insurance until you need it. And so it just seems like so overwhelming, almost like, throw that under the rug until I have to understand it better. And that's why we have an entire department that has to help kind of sort through it for people. So let's talk about telehealth. What kind of impact does that have on people's just finances, medical finances?
Yeah, so telehealth is quite phenomenal, especially today when gas prices are so high, is that we can actually meet you where you are. You don't have to get in your car. Yeah. You can actually stay at home, especially under the public health emergency, that those kind of regulations before that have really allowed more patients access to their care in the convenience of their home. And so telehealth has been quite phenomenal in some of the work that we've done and seen with just kind of saving things on simple things like gas.
Show us through pictures. It's so much easier to understand healthcare through pictures, and you made a graph that I can understand.
Yeah, this is a little elementary, but I put this together, and so what we've done is we track the amount of visits that we've had, and so from January to May, we've had just under 68,000 500 telehealth encounters. And so what we do is we look at where our patients are coming from. And on average, our patients are driving one way about 8.5 miles. And so round trip, that's about 17 miles. You know, total, that's a little over 1.1 million miles that patients didn't have to drive to come to our hospital to see their physician. They got to see them on their smart device, in the comfort of their home or at work or somewhere else. And so I did just kind of quick math on what that looked like from a financial perspective with just gasoline. So I averaged the prices out for the last, from January to May. The average price of gas, now we're seeing it much higher at a pump today, but the average was just shy of $4. That was over $182,000 that our patients didn't have to spend on just gas alone. Not to mention things you can see up in the upper right-hand corner, things like travel, taking time off from work, child care, and some of our patients come from a long distance, even just, getting a hotel for the night and getting food. Those are all savings that our patients didn't have to spend through just the devices we have in our hand to see our physicians.
You can imagine somebody just struggling to get engaged with their own health care, and then you add something like these kind of gas prices. It just takes one factor to make somebody go, hey, I'll defer this for a while.
Absolutely, yeah. We do want our patients to get engaged with us, not only from a financials perspective, but engage with our physicians. Mm-hmm. Ask, can I do this appointment via telehealth to save on a lot of those things that are contributing factors that are preventing patients from making decisions to just come in and see their doctor.
All right, Gail. Just first of all, I want to ask you, first of all, good morning, thanks for being with us. What are you hearing from patients? What are their concerns right now?
Just like Jason spoke about, the cost of everything is up, and that makes life harder, especially for patients who are already financially drained and on a fixed income. It just makes life more difficult in general.
Do you really have to have those tough conversations and advocate for them to put their health first?
Absolutely.
Let's be honest, that's got to take a back burner because it doesn't feel immediate.
Yes, definitely.
So there was an example that made the news recently, these gas vouchers provided through an American Cancer Society grant. So listen first to what a couple of patients said about these vouchers, how they help. These patients drive 50 miles one way, sometimes daily, for their cancer treatments.
Well, obviously we started with, I think 8 rounds of chemo, of course, diagnosed, and you run through all the PET scans and CAT scans and, to locate it. And I was surprised to look at my chart the other day and realize that I'd made over 75 trips, and it runs about $60 round trip just in fuel, not much less wear and tear on the car. So that ended up being around $4,500 just out of pocket for gas. So the gas cards that they provided really helped out. I mean, it covered about 3 trips, but it gets pretty exciting when you can help take care of it a little bit.
Yeah, it's sad when getting a voucher just for gas helps so much, and that's exciting because you're knocking some of that off, and in this case, $4,500 for that gentleman. Gail, how do people qualify to get these vouchers?
Yeah, so we were fortunate to receive a financial grant through American Cancer Society. It's specifically for transportation in order to help patients with transportation-related costs, getting to and from treatment appointments and oncology-related visits. We provide things such as gas cards, cab passes, even bus vouchers to help patients get to and from.
It's that saying, it never hurts to ask, but people have to know to ask to get the help. So what should people be doing? What questions should they be asking, and who, when they are engaged with a provider or someone like yourself, what do they need to be asking for?
I think just talking with your care team, letting them know you have a concern or an issue, they'll get you connected to the right folks. We've got social workers in all of our cancer centers that can help with these types of issues and screen the patients and get them connected.
And our health system, of course, is not immune to inflation. That means our costs go up too, just like everyone else. What can patients do to best communicate and better understand their medical costs and maybe what they're up against?
Yeah, I think the best defense, like Jason spoke earlier, is understanding your insurance before you need to use it. Really knowing what options you have, what are your co-pays, your co-insurance deductibles, and your out-of-pocket max, so that you can kind of plan and budget ahead of time for those expenses.
We are going to get to some audience questions here in just a few moments, so get them in the threads right there on YouTube, Facebook, and you can also email us at the Medical News Network. You'll find links to those on our screen and in the feed. But first, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us on this Monday morning with our COVID count. How are you?
Yeah, hi.
Hi, good morning.
It's Monday.
Yeah.
So the COVID count, the active infections, certainly in our health system and our hospital, has gone up over the past week or 2 weeks. Right now we have 22 active infections, 1 in the ICU, that patient's on the ventilator, and 10 in that recovery period. You know, overall the numbers have increased. We know for quite a few weeks now we have had increased cases that have been reported. But I think this is part of a consequence of the past few weeks where we've had increased cases, although this surge currently is not anywhere near the Delta Omicron. So I think we're still doing very well as far as active infections go. We would still like that number to be down, but we know as we have a high amount of circulation of the virus, we have to expect that with that, there will be small numbers of people hospitalized.
All right, a few questions for you before we get out of here. The CDC reports that monkeypox may have been silently circulating from back in 2018. What do you hear about that? What do you make of that?
I think so. Again, in African countries, we know that they have been dealing with these outbreaks of monkeypox for quite a few years, even as far back as 2017 in certain areas. So I think this is not unheard of, especially as we're learning more and more about how this may be presenting a little bit differently in certain populations, this current outbreak in non-African countries as well. And so I think we are just learning more and more about it. I don't believe right now we still need to consider it an emergency. I know World Health Organization is continuing to look at that. We do have antiviral drugs if it's needed. We also do have vaccination for smallpox, which is being utilized in certain areas and communities in a ring vaccination type program. For instance, if someone or a group of people are close contacts of known cases, they are getting vaccinated. So we do have very good preventive measures. We'll just kind of keep going day to day. I know that day by day we are identifying more cases around the world, and we are also identifying more cases here in the United States, but really no current public health emergency at this point in time.
Moving on to modeling, there was a Lancet study estimating COVID-19 vaccines prevented nearly 20 million deaths worldwide, representing about 63% fewer total deaths during the first year of COVID during the vaccination. Your thoughts on that?
I mean, vaccination works. It is extremely important. We know that debate continues today, unfortunately. You know, vaccination remains very vital. It means it remains the safest way towards individual immunity. We also know that infection and vaccination, or vaccination and infection, does help increase the breadth, the variety of antibodies. And so it is important, even if you have been infected, especially with Omicron, it is important to get vaccinated because just with infection with Omicron, you will develop antibodies only towards that. But we know that if you have vaccination, you are also going to be developing those antibodies towards other variants of concern as well.
Okay, lastly, it looks like another vaccine in the pipeline getting some pretty good reviews. It looks like it's pretty highly effective against Omicron. What can you tell us about that?
Yeah, again, this is a protein subunit vaccine, so it's just really basically that spike protein. Older technology as well, so that's been around. It's not new science or new technology. Again, I think this is one more good thing that we can use. It does look safe. I think that's the most important thing, and it does look to have efficacy against some symptomatic disease, but really mostly what we are looking for is efficacy against hospitalization, severe disease, and death. And I think any amount or any new vaccines that we can have on the market to help people get them is going to be good. We know that they are showing to be effective at keeping people out of the hospital.
Thanks so much. Okay, we are back with Jason Grunstrom, the Executive Director of Continuum of Care, and Gail Saunders, Social Worker Manager here at the health system. So, Gail, just what do you hear patients say they might, when they say they might defer health care? What are those conversations like? It seems like naturally you would say, no, let's not, but sometimes that might not be a reality.
Yeah, we definitely have that come up. Unfortunately, I think it's important to help patients understand that they need to make their health care a priority. I think if you have a serious health issue going on and you delay care for that, the cost in the long run could be a lot higher than taking care of it early.
So Jason, I know you're always working on the math problem when it comes to healthcare in some way or another. What gives you hope, and where do you and who do you think patients should talk to about managing their ongoing expenses? So how do we kind of, I don't know, ease the pain a little bit and let people know, don't turn away from it. Let's hit it head on.
Absolutely. Just what Gail said, both just right now and previously, the earlier you can have an intervention with when you're not feeling well or when something's not right is probably the best time from a financial perspective, to really tackle it head on. I think sometimes, and I'm at fault for doing this, sometimes it's like, oh, I can wait a little bit longer. Well, the problem is that when you wait a little longer, sometimes the disease gets even worse and it gets more expensive to fix. And so, in addition to that, we have resources here at the organization at the health system to really help patients, guide them, and understand where the resources are. Gail showed that, shared with that wonderful grant that we had for gas cards, but we also have some other options in our organization to help really with the finances. So I really want to encourage you, when you get to our health system, to talk with people and ask, hey, I'm really struggling with this, but I want to make sure that I get my health care right away. So those are kind of the things that I would recommend right away when you get here and you have those concerns.
Well, I think what you're saying is help is out there, but I think it's hard because when people think of the big health system overall in our country, it's like, come in and then we're going to stick you with a big bill and then you're on your own. And I think you're here to say, no, we're trying to help you see it all the way through, not just with the health issues, but then the medical and the medical bill issue that it creates afterwards.
Absolutely. Healthcare can always be a scary thing, not just the disease itself, but then wondering, what is this going to cost me? And we're here to help. We absolutely want you to think about yourself first, think about your healthcare first, and getting better. But we also are here to help, and there are many opportunities and things that we can do to work with you on these things to make it less scary and to navigate it really well.
Okay, Gail, I was reading a recent article on CNBC. It really stuck with me. Reported that a 65-year-old couple retiring this year in 2022, they'll spend an average of $315,000 in medical expenses just throughout their retirement. That's according to Fidelity Investments. That's 5% higher than it was last year. Will Medicare be enough for that hypothetical situation? And we know can't possibly be that hypothetical. I'm sure it's happening all across the country.
Right. I think, it's fair to say as we age, our healthcare costs may rise. Medicare is quite confusing for a lot of people. So there's many types and parts to Medicare. There's supplemental plans, advantage plans. Some folks have Medicare and a secondary insurance to kind of fill that gap of medical expenses, and really knowing what type you have, what does that cover, can be helpful in ensuring you have good coverage.
I want to hear from both of you just your best advice on how people of all age, the young family starting out, the single guy or gal out there, all the way up to the empty nester family, to the aging single person. What is some good advice on how to save, how to prepare to really take care of your medical bill health and to really have that stowed away when you need it?
I love that we're having this conversation today. I mean, I think just understanding that $315,000 of my expenses after the age of 65 is going to hit me somehow in some way. Saving is very important, and saving early. I read a report that if at the age of 18 you start saving $100 a month on up to 20 when you're 27, and then stop saving, by the time you retire, you'll have a little over $1 million in savings just by putting it away in like a Roth IRA or something like that. You continue doing that and using whatever resources you have to save. And I know that that's hard for some people, that we need to prepare early and often. And preparing is, things like just getting out for a run and eating healthier. That's a way to prepare, whether you think of it financially or not. Yeah. It's a way to prepare. So those are some of the things that I encourage. Now, again, I said earlier, is read your health insurance plan. Sometimes I've had to navigate my parents through that because it is confusing. My parents on Medicare with supplemental, and sometimes they don't understand exactly what that meant. And so, of course, they ask their son who works in a hospital, what does this mean? And sometimes it's a little confusing for me. So I reach out to people like Gail and I say, what does this mean? So you're not alone. And so we have the resources here, but I encourage you to always know, what is covered, what isn't covered. And then look at family history. Say, we have a history of this. And so get those plans that cover those things, the supplemental plans, just in case. And so those are very important. That's kind of the recommendations I'd give.
Yeah, and do you think health care in general and health systems across the country have just gotten better at making it easy? But here's the number. If you have a question, email me, call me here so that people can navigate through those questions that they have. Do you think it's getting better? People are understanding that people need to get more engaged on the medical bill side of their health care?
Absolutely. I mean, we have a whole financial advising department to help patients understand their bills and insurance. Social workers, a lot of the times in most of our clinics, that can be helpful in getting them in the right direction to get advice and guidance.
What kind of advice do you give? Because I'm sure you hear every type of story. People come from all over and they come with all sorts of different circumstances. What are some good pieces of advice that we all could take away?
Yeah, like Jason said, understanding your insurance, knowing your options when you're choosing insurance, what makes sense for your lifestyle, family history, things like that. Really, understanding the costs associated with healthcare, those co-pays, deductibles, out-of-pocket maxes. Do your research, educate yourself. Also, knowing who's in network with your provider can be helpful in keeping costs lower than choosing a provider that's out of network. I think, again, it's just important to educate yourself and do your research.
So what about patients who do not have insurance coverage? Are we able to help them in any way?
Absolutely. We do have resources, financial resources for those patients who come in and do not have insurance. So again, in some cases, it's an emergency and you didn't plan that, but even after your medical event, coming in and talking to our financials encounter, financial planner, we can absolutely help those who even don't have insurance. And that's not the first time we've dealt with that quite a bit throughout the history. And so I want to encourage you again to just, reach out to you. You do get wonderful resources with case managers and social workers who can help point you in the right direction to get the resources you need from a financial perspective.
All right, I want to get to some community questions now if we can. And Georgianne, I know you're a daily viewer of ours, and she said she drove 67 miles each way for her cancer treatment here. She said fortunately gas prices weren't so high, but it's a struggle, and you hate to think people are concerned about that and staying away. So could you talk about the payment plans and how it can protect people's credit? I think that's something people get really concerned about. How does that all work into that?
That's a great question. Yes, never let I hear these stories of people who just kind of let the bills collect in their mailbox. Don't ever do that. When you open them and they are kind of a little daunting, again, call the financial advisors here at the health system, because when you get on a payment plan, it does help you so much, especially if your credit score will prevent a lot of times from things getting sent over to the creditors. If you're engaged with us and you let us know, hey, we want to work with you, instead of just trying to ignore it. Sometimes that's the worst thing to do, is to just kind of think, I don't want to look at this right now, but actually engage with us and we can work with you, and it's immensely helpful for even something as simple as your credit score. Well,
and you may have just answered Jack's question, but are some medical bills forgiven or lowered if a good faith conversation is had, a phone call, a payment is made? I mean, I think that really goes a long way.
Absolutely. I can't say that for 100% of every bill, but
right.
But yes, absolutely. When you talk with someone, we can work with you on what that looks like, and then some of those charges kind of work with those things as well.
And take the fear away. That is manageable. There is light at the end of the tunnel. We can get these paid somehow, some way.
I've spoken with our financial counselors here and planners at the organization. They are kind and sweet people, and they help in the nicest way. They're incredibly calming, and they really show you the options that you have when you kind of get hit with some of these bills that you weren't aware of.
There are options, so that's good to know. Heather wants to know, and I think you mentioned this a little bit, Gail, but do you work with the providers to see if there are certain procedures that might be able to be held off, or does that start at the provider level? But if you were to be counseling somebody and they said, I have this, I need to get this taken care of, would that be something you would interact with on, the clinical side to say maybe this is something that could be held off, or is it like, nope, we got to get you in?
Yeah, absolutely. Our social work team works very closely with the providers in helping with those conversations to know, what needs to be done absolutely right now. We are oftentimes talking a lot about medications as well. Sometimes the providers don't know which medicines are super costly versus there's a cheaper alternative, and so we can kind of talk with our pharmacists and see what other options the patients might have that are more affordable, and then take that conversation back to the providers to see if that is a feasible medicine for that patient.
Dr. Hawkinson, Michelle wants to know, moving forward, as far as boosters are concerned, are they planning to keep the original formula of the vaccine, or just add more variant protection like Omicron or something? Or do you have to say that you can make these a yearly vaccine?
Yeah, that's a great question. We know that the companies, particularly Moderna and Pfizer, have put out press releases, although I haven't seen the full data, saying that their vaccines do elicit a good response. By this, all that I've seen is that they mean increased antibody responses. We know also that one of the committees for the FDA is currently, I think this week, going to actually be looking at determining if new strains or variant spikes or variants of concern should be put into the vaccine. So that is being worked on right now. Again, there is the single vaccine with the single spike, but we know Moderna and Pfizer have worked on a bivalent vaccine, so having two different spikes in there. The one spike is the original one, and then they're also now combined it with an Omicron spike as well. So they are looking at that information. That's a very good question. The committee will be looking at all that data, I believe, this week to go over that, and will hopefully some of these questions that were just asked will be answered, such as will there be more than one spike? Will it be a different formulation because of that? And then also, what will that schedule be? When should we get it? Will it be a yearly thing? Things of that nature. So those are things that are being actively asked and looked at right now.
Janet also wants to know, when should healthy young adults receive their next COVID booster shot?
Yeah, well, right now, as far as a second booster, it's really only for those healthy adults 50 and over. Obviously, if you are immune compromised, you should have gotten a second booster as well. So I think these are questions that are going to be answered fairly soon, because we know the FDA and the CDC wants to get those recommendations in prior to the fall. So that is why they are going to be meeting here, right now through July to determine those types of things.
Last question. Isaac wants to know, do we assist with apartments or hotel stays for cancer patients undergoing treatment, whether they live nearby or out of state or out of, on the other side of the state line?
Yeah. American Cancer Society also has a Hope Lodge location here in Kansas City. We use them quite frequently. It is free lodging for patients going through cancer treatment. Apartments, not so much, but definitely have options with
Well,
Hope
they probably
Lodge.
said apartments because they didn't know about the Hope Lodge. So that's what I think is great. These are these are places that people do not know about. And so when they ask the question, the good news is you have a great answer on the other end of that question. So that's really nice, So thank you so much. It's such a great, important conversation to have, and we'll keep having it. Let's get some final thoughts, though. Jason, just what do you want folks to know today?
Yeah, I mean, we're doing everything we can to help with these financial kind of situations we're in right now. Telehealth, of course, is having an impact in certain ways. But again, really just engage with us. We're here for you, and we want to make sure that you are comfortable in knowing that I can still pursue the treatments that I need right now and not holding off on them. We're here for you, and we have a lot of resources there here to help provide you and navigate some of these questions that you may have, both from just how to navigate my care, but also my financial care as well.
I'm curious, though, because we know that telehealth really kicked into high gear during COVID for obvious reasons, but just curious, are we tracking, though, because of these high gas prices? I can't imagine telehealth is just booming. Absolutely.
Before the pandemic, we were seeing about 100 patients a month. During the height of the pandemic, we were seeing about 1,700 patients a day, and so that was phenomenal. Now we're seeing about 600 to 700 patients a day, and we have seen a little bit of an uptick recently with patients who are saying, you know what, can I talk to my doctor? Can I see if we can do this through telehealth? And yeah, that option is always there. Sometimes you can't, but a number of times you can absolutely see your physician through telehealth, and it helps us not only with gas, but also helps us with all those other things we kind of mentioned, to just quickly see your doctor and kind of move on.
Well, so many people were telehealth resistant, but I think we're finding how useful it can really be, right?
That's right.
Gail, final thoughts today.
I just want to say thank you for highlighting this topic. I think it's important to talk about and get patients connected to the right resources.
Please come back anytime if you have more to share. Always welcome. Dr. Hawkinson, final thoughts.
I think, again, good questions about the vaccines. Hopefully within the next couple weeks we'll have some of these questions answered about when should other people be getting boosted again and what will the formulations be. Hopefully we'll have some answers for you. We know that the committees are starting to meet now this week about those things.
Thank you all. Yeah. Well, in headlines this morning, stepping up to the plate to help those with cancer. I want to show you some video from the Blood and Marrow Transplant Donor Awareness Day out at the K from this past Saturday. Members of the University of Kansas Cancer Center were there to help explain the importance of being a BMT donor and gave them a chance to sign up for the Be the MASH National Marrow Donor Program. Dr. Elizabeth Monks is a psychologist who works with patients in the cancer program. She says only 30% of patients who need bone marrow transplants have a matching donor inside their own family.
A lot of people, I think it's close to 70% of people, will not have like a sibling that can donate stem cells to them, so they have to go to these registries and rely on basically the good nature of humanity.
And here's a number that might surprise you. Only about 2% of the nation is currently on that registry. Doctors say the best candidates for the registry are between the ages of 18 and 40 and good physical health. Well, we are going behind the mask this morning to introduce you to one of our health system employees making a difference. This is a new feature we are adding to the morning medical update. This morning, we meet a doctor who was recently promoted for his service to our country.
In view of these special qualities and his demonstrated potential to serve in the higher grade, Major Bonte is promoted to the permanent grade of Lieutenant Colonel.
Being in a family with another service member, it's kind of special to share a promotion like this and have have a sibling there who's had his own distinguished career in the military, and kind of be able to share that and to read the oath of office is really special.
The President of the United States, acting upon the recommendation of the Secretary of the Army, has placed special trust and confidence in the patriotism, integrity, and abilities of Major Matthew Bonte. Well, I think the Army holds promotion days as something really special, right? They don't come very often, and these days with promotion rates, not everyone gets one. So they certainly stand alone as a hallmark day of something to be celebrated.
All right. Thank you all.
This promotion now means Dr. Bonte will be leaving the health system very soon for an Army Medical Center in Honolulu, Hawaii. So congratulations, Dr. Bonte. We shall miss you. And thank you all so much for being with us on this Monday. Don't forget, you can catch our update anytime by logging onto Facebook, YouTube, and Twitter. Tomorrow, we look back on how COVID-19 impacted those working in the ICU. And we'll be back live Wednesday at 8 a.m. Please go out, make it a great day. We'll see you then. The number of women in prison has increased by 475% since 1980. On the next Open Mics with Dr. Stites, we go behind bars to talk sexual health with incarcerated women. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.